Dr. Mandy Cohen says North Carolina has already given out more than 500,000 doses of the COVID-19 vaccine, despite what the CDC dashboard shows. Dr. Cohen says there's 150,000 dose difference in the sites. She also says the disconnect is because of how fast things are moving here in North Carolina. Now, the North Carolina Department of Health and Human Services is working with the CDC to get the updated information online as soon as possible.
This week, we've seen the long lines and felt the frustration for those trying to sign up to get vaccinated. CBS 17's Colleen Quigley is live and learned that despite this, there are some cases where doses are going unused. She's getting answers for us tonight. Colleen.
Yeah, Angela, Dr. Cohen told us this afternoon that a small number of doses were actually thrown out by hospitals that didn't have anyone to administer it to. She says that's actually counter of the state's plan. Their goal is to run out of vaccine because they're using it up each week.
Goodbye.
This week, we've seen county websites and phone lines crash as people try to sign up to get vaccinated, and lines backed up for miles as people wait for vaccine, only to be turned away when there weren't any doses left.
Our goal is to make sure we are using up all the vaccine that is coming to our state.
But Dr. Mandy Cohen says there have been some instances where COVID-19 vaccine has been thrown out before it was administered.
But it's very few, like in the tens of doses. But even that, for me, is too much.
To curb this, Cohen says they've started transferring vaccine from hospitals that have extra doses to clinics or health departments that don't have enough.
Just yesterday, that's one day only, we had 40,000 transfers of vaccine alone from one provider to another.
DHHS is advising vaccine providers to have wait lists and call someone from it if there's any leftover vaccine at the end of the day.
If you even can't find someone on that priority list, find the closest arm of who wants to get vaccinated and get that in, because we as a state don't want to waste any vaccine.
Well, back live now. She says each week the state gets 120,000 first doses from the federal government. She says it's important that we show the federal government we're using all of that up because they want to be effective and